Joe, can you guys hear me again?
Yeah, we're having troubles with our phone.
Okay.
The mute button that says mute doesn't mute. It does something else.
Yeah,
So
what you guys just did, put on a music hold, so you won't want to do that because everyone will hear the music instead of
no,
all
so we got to figure out which button does mute.
Yep. Okay. Okay, and thank you to everyone who's joined us for the National Center for Rural Road Safety's second July webinar. My name is Jamie Sullivan. I am the manager for the Safety Center. We are going to go ahead and get started now. I'm going to start by closing out the polls on the right-hand side and giving you some information from those. So it looks like today we have about 7% of you guys from the Northeast, about 32% from the Southeast, about 22% from the Midwest, about 32% from the West, and 5% from others. As far as how many of you are joining us in a room, there's about 86% of you guys watching by yourself. And then we do have, as always, a few groups. So we have about 7% in groups of 2 to 3 people, about 5% of a group 4 to 5, about 2% of a group 6 to 9. And when I do switch us over to the presentation, again, I will go through some information to make sure that we have everyone in the group's contact information so that you may receive certificates. As far as what transportation organizations you're with, we have about 11% Federal Transportation Department, about 11% State DOT, about 15% Local Department of Transportation. We have about 2% tribal governments, about 2% public land agencies, 11% LTAPs, 15% other federal, state, or local government agencies. And we have about 13% education and 17% private consultant and then 2% other. So welcome everyone. We're glad that we have such a multidisciplinary group today. This will be a great discussion. And it does look like we have about 80% of you on computer only and about 20% of you on both. So we will remind you, as always, if you do have any audio issues, we would ask that you please dial in if you are joining us by computer only. The phone number is in the top left-hand corner. You may also use that chat pod on the left-hand side to talk with our technical person about any questions or problems you may be having. At this point, I am going to move us over to our presentation and go through just a few more things for everybody. Okay, perfect. So a few more logistics for everyone. Today's webinar will be an hour and a half long. It is being recorded and will be archived on our website. For quality of that recording, we do have everyone other than our speakers muted for today's presentation. Because of this, if you are listening, if you do have questions you'd like to ask, the chat pod is on the left-hand side. You may feel free to put those questions into the chat pod at any time. And when we do stop at our question and answer sections today, of which there will be 3, I'll make sure to read those questions out to our presenters. If you are listening on the phone, for those 20% of you that were doing both, we would ask that you please mute your computer speakers, otherwise you will hear some feedback. I also want to point out that in the top right-hand corner of your screen, there are 4 arrows that press outward or point outward. If you press on that button, it will make your PowerPoint full screen. This will be helpful for some of the figures and graphics that will be shown today. In order to get back out of that, you will hover up at the top of the screen and it will give you that 4 arrows out again, so you can press it one more time and get back to the full screen. When you do that again, it will just get rid of all of the information around the outside, so the attendee list, the chat pod, the handouts, and the closed caption pod. I do want to mention again about that handout pod, bottom left-hand corner. In that you will find a PDF of the presentation for today, which you can download. You will also find a handout that one of our speakers will be talking about as well that they wanted to make available to you. You will also find at the end of today's presentation there will be 2 slides full of resource links. Again, if you do want access to those after the fact, you may also download that PDF of the presentation to get those. All of this information will also be posted on the Safety Center's website with the archived version. We will also have 2 follow-up surveys. They are vital for us assessing our webinar qualities. The first one will go out directly following today's webinar. It is a detailed survey that asks questions about the speakers, the content, and any technical issues that you may have, but most importantly, it has the checkboxes for if you would like a certificate or the CEUs. You'll now see on your screen that survey link in case you do not receive it via email. We found that because this comes through our constant contact list, it does tend to end up in people's junk boxes, so we like to provide it to you right now as well. The survey closes 2 weeks after today's webinar, and you can expect your certificates and CEU forms to be mailed to you or emailed to you in approximately 4 to 6 weeks after we've manually created those. If you attended our May or our June webinars, those emails just got sent out within the last hour, so check your inboxes and junk boxes for those if you requested them. When you return your CEU forms, you want to make sure those go to continuinged@montana.edu and not to the Safety Center. There's some information that's requested in that goes directly to Montana State University and not as part of the Safety Center. You can also request a verification of completion form to see what CEUs you do have available to you that you've asked for. Right now on your screen, you'll see the top left-hand corner is what a course registration form will look like for the CEUs, and in the bottom right-hand corner is what a verification of completion form would look like if you request those. So the verification form would list every webinar that you've attended for the Safety Center that you have requested CEUs for, as well as our summits. We had 2 safety summits that also had CEUs available, and it will provide you with the total number that you have. I'd like to thank the National LTAP and TTAP Association and their safety committee for co-hosting today's webinar with us. And then I would like to tell you about our speakers as well. So we will have 4 speakers for today, and as I mentioned, there will be 3 different sections and 3 different question and answer periods. Our first speaker is Seth LaJeunesse. He is a senior research associate from UNC Highway Safety Research Center. He evaluates behavioral interventions designed to enhance bicycle and pedestrian safety and access, and design studies that draw from psychology, sociology, and systems science. Seth serves as the principal investigator of several state and federally funded research endeavors, including projects funded by the North Carolina Department of Transportation, the North Carolina Governor's Highway Safety Program, CSCRS, and the U.S. Department of Agriculture. Across all research projects, he aims to advance safe, equitable access to physical activity and community life. And our second speaker will be Wes Kumfer, and I apologize if I'm pronouncing everyone's last names wrong. As you do start to speak, you may fix my pronunciation of your last names if I said them wrong. Wes is the research program manager for the Collaborative Sciences Center for Road Safety, and as well as a research associate at UNC Highway Safety Research Center. He recently completed the CSCRS funded research to define safe systems approaches and is active in several research projects to apply safe systems principles to intersection design guidance and other agency processes. Prior to joining HSRC, Dr. Kumfer worked at Texas Tech University in Lubbock, Texas, as part of the Texas Tech University Center for Multidisciplinary Research in Transportation, where he worked on a number of Texas Department of Transportation projects related to rural road safety. And then we will have two speakers who are representing Clackamas County. First, we'll have Rob Sadowsky, who is the Transportation Safety Outreach Coordinator for the Department of Transportation and Development of Clackamas County, Oregon. Rob has more than 30 years of public experience in housing, economic development, and transportation. He has served as the Executive Director of the Street Trust, formerly the Bicycle Transportation Alliance in Portland, Oregon, the Active Transportation Alliance in Chicago, and the Chicago Mutual Housing Network. Rob served as the Director of Corporate and Foundation Giving at the Jewish Council on Urban Affairs and as the Director of Community Ventures Program, an innovative program linking private investors in affordable housing and economic development projects. He brings experience in training low-income housing residents in resident management and ownership. He conducts training and strategic planning workshops for emerging organizations and is a board member for the Training for Trainers Cooperative. Rob loves serving as a management or executive coach and helping dynamic nonprofits and companies level up to thrive. He holds an executive master's in public administration at Portland State University and a bachelor's degree from the University of Michigan's Residential College in Social Science. He has served on committees focusing on climate change, affordable housing, transportation safety, and low-income transit fares. And last but certainly not least, we'll have Joe Marek, who is the Traffic Safety Program Manager in Clackamas County, Oregon, where he has lived and worked for over 25 years. He oversees the Traffic Engineering Group, Drive to Zero program, and the Motor Carrier Safety Program. Joe led the effort to create the county's first Transportation Safety Action Plan in 2012 and an update in 2019. The county's unique approach has been one that has been recognized that traffic crashes affect all departments in the county, and a goal of 0 fatalities cannot be achieved unless the goal is embraced by the entire organization. And again, we are very thankful to have all 4 of our speakers with us today. Our goal of our webinar today is an understanding of the principles of safe systems and to context for the safe systems approach in relation to other traffic safety initiatives such as Vision Zero and Paradigms. In order to achieve that goal, we're going to have 5 learning outcomes. By the end of the webinar, we hope you will learn to describe the safety, health, and mobility needs of rural populations, to summarize core principles of safe systems, to differentiate safe systems practices from other approaches to roadway management, to illustrate specific safe systems processes or practices in rural contexts, and lastly, to learn about the concept of micro-targeting and the inherent challenges in data mining for government agencies. Now, before I do pass you over to our first speaker, we did have a pre-poll that we would like to ask for everybody. Our first pre-poll is, do you think your agency already practices safe systems? Yes, no, or I don't know. And our second one is, does your agency share funding streams and design decisions with other agencies? Yes, no, or I don't know. And we'll give everyone just a few seconds to fill these out. Okay, I'm going to end these polls and broadcast them now. And Seth and Wes, I believe you guys asked similar questions in one of your recent webinars, so I wonder if you'd like to address these poll questions and whether or not they may be similar to what you heard in your last webinar as well.
Sure, I can answer that. So as far as the agencies who feel that they do practice safe systems, I believe it was a similar ratio. And I said on that previous webinar that I was a bit surprised but also encouraged by that. If a lot of folks feel that they are embracing in road safety practices that approach this new paradigm, that is very encouraging. The second question, I actually think this is a higher percentage than I've seen before. That's also encouraging. We hope maybe that some of these rural road agencies are tapping into some of the different funding streams. And we hope with this webinar that you'll walk away with at least some ideas, if not concrete points to take away regarding how you can tap into those if you don't already.
Perfect, thank you. I'm going to move us back over to the presentation. And then I'd like to hand it back off to Seth.
All right, thank you, Jamie. And welcome, everybody. Jamie, thank you very much, and the National Center for Rural Road Safety for inviting myself and Wes at the Highway Safety Research Center to speak with everyone today. Very pleased to do so. And to touch upon these 2 sort of learning objectives. Describe the safety, health, and mobility needs of rural populations. Certainly can't cover all of that, but we're going to sort of do a bit of a brief survey of that. Summarize core principles of safe systems. So that's where we'll sort of go over some key principles of what we how we're considering at the Collaborative Sciences Center for Road Safety, how we're considering safe systems. So just to begin, looking nationally, when you look at rural relevant traffic safety issues, we tend to see a number of things that are pretty prevalent that are somewhat unique to rural areas. certainly not wholly unique, but to some extent. Alcohol and drug-impaired driving, pedestrian safety, access to emergency services, and speeding, which my colleague Wes will discuss in greater detail later. Certainly we could add other things, novice and older drivers to this, run off-road, off-road crash types, things of that nature. These are just ones that are pretty pandemic. They're across the board that we see. I'm going to cover each one in a bit of detail. First one, alcohol and drug-impaired driving. So the latter part of that, drug-impaired driving, we know we're beginning to develop a knowledge base about that. But there is no, right now, like in alcohol, standard way to assess that, especially on site and even at hospitals. There hasn't been a really good standard for that, unlike what we have for alcohol. We do know it's an issue, especially with the opioid epidemic. I'm sure many of you are aware of. Also the polydrug use that we're starting to see more of as well. This, I just want to orient the attention to what NHTSA has put out on alcohol-impaired driving. You know, they tend to look at fatalities by a certain construct like alcohol-involved driving and related to different elements. So like the month of the year, weather, light conditions under which these events occurred, but also the one that we see, the land use. This is significant because 45% of them, of these alcohol-impaired drivers involved in fatal crashes, are happening in rural areas, despite less than 20% of the population living in these areas. So we know that there's an over-representation in this sort of event type happening. Now, as regards to pedestrian safety, what we tend to see in rural areas too is really the safety concern here is when we're talking about people crossing the street in between roadway intersections. As we know, intersections are not nearly as dense in rural areas as they are in urban areas. So we have a lot of these problems. Rural roads tend to also harbor higher than average travel speeds. So it becomes sort of an issue in a lot of these locations. One treatment I just wanted to put out there is something that is being experimented with a lot in Michigan and in Florida, also right now in Minnesota, are these what are called gateway treatments. You see an illustration there, and there's actually a guide for how to sort of install one. You see that R16, traditional yield to pedestrian, in-street pedestrian sign that's NUPCD approved, as well as a bollard or a center line divider there that's hardening that sort of center if there's a 4-lane cross-section you're looking at. What this tends to do is slow traffic down on the advance of the crosswalk because now they have to straddle these signs and they don't want to hit them. So in some of the really solid studies that have been done on this, they've seen really significant increases in yielding from baselines of 15% yielding to 70% after installation, as well as speed reductions upon the approach of 4 to 10 miles an hour, which has really significant safety benefits. Another systemic issue that we're seeing across the country are these issues of rural hospitals closing. This report from Modern Healthcare from February suggesting at that point that nearly a quarter of them are on the brink of closure. This has been happening for years now. Where we are in North Carolina, it's certainly been happening as well. The Towards Zero Deaths committee that convened about a decade ago understood this and noticed these trends and believed that these 3 things are critical, which I couldn't agree more with, is that we need to have enhanced incident detection out in these rural reaches, as well as this more responsive EMS response to the scene. Where especially it's remote, on-scene medical care becomes critical. And then where, the higher level trauma centers that could sort of welcome the entire continuum of care, this becomes critical. So having equitable access to these higher level trauma centers is really important as well. It's something that we have to really look at on state and national levels. So this brings us to what's been going on in the U.S. Just in the last decade, starting sort of 2008, 2009, with towards zero deaths. I'm going to talk about each of these. So this is more of state DOT sort of led initiatives. Then we have Vision Zero. I'm sure many of you are aware of this program. This is more of a city or municipal led initiative that is starting to take root across cities in the U.S. And lastly, we have, and probably more recently, the Road to Zero Coalition, which is more organizationally driven. The National Safety Council heads this up. There's about 800 organizations, dealing with various traffic safety issues from different angles that comprise the Road to Zero. Road to Zero Coalition is also unique among these zero initiatives as being the only grant provider in this group. And we'll hear more about that in Clackamas County from our colleagues. So just quickly, towards zero deaths, if you're familiar with it, a strategy was put out, a national strategy on highway safety. Again, this was really targeted toward state DOTs to start really thinking through on a systemic level the different road users, drivers and passengers, but also people outside of vehicles or vulnerable road users. How we're dealing with regulations related to safer vehicles and design of these things, safer infrastructure, and of course that EMS issue, so enhancing those services. And then just generally speaking on a statewide level, how do we improve our safety management programming? So it's really, I recommend checking it out if you're interested, especially or operating on a state level. The Vision Zero Cities, this is about late 2013 is when this sort of kicked off. New York City was the first sort of adopting city, officially adopting city in the U.S. And then up until more recently, it's now several dozen cities are signing on and committing to Vision Zero. This tends to mean some higher level mayoral support for this. Usually multidisciplinary task forces are formed, and then some type of action plan for achieving Vision Zero. So there's more resources at that link down there for the Vision Zero network, a lot of different resources, mostly targeting the municipal level or the city level. And then we have the Road to Zero, again, most recently. Again, headed by the National Safety Council, working with RAND Corporation to develop this vision or the framework for how we get to zero fatalities by 2050. And when you look in this report, it's a really comprehensive, thoughtful report. You'll see three broad brush sort of strategies they lay out. The first one is doubling down on what works, so related to the fact that there's been a lot of research on a lot of different countermeasures and interventions. If we just applied them more broadly, then we'd have a lot of safety gains by just using what we know works. Advanced technology, these are things like ITS, connected and autonomous vehicles. So as things come online, how can we sort of coordinate them to advance safety? And then the last one is this more interesting cultural element of prioritizing safety. How do we sort of encourage the public, people that build and maintain roads, people doing programming, organizations that work in traffic safety, how do we get them to start thinking about safety as a priority, or develop that, what you may have heard is the traffic safety culture. That's what that's getting at. So the basic premise here is that we rightly, I think as a culture right now, those involved in traffic safety, we desire a zero fatality future. The question then is, how do we get there? And what we proposed at the Collaborative Sciences Center for Road Safety, or CSCRS, is that it's through this approach called safe systems. Now, what do I mean by that? Safe systems, just for definitional clarity here, it draws upon system science, which has been around, the tools of which have been around for a long time, to advance these principles that I'll touch upon. So you'll see on the right there these tools and sort of frameworks from system science applied to safe systems. And that CSCRS in the middle there is the Collaborative Science Center for Road Safety. So I'll talk about each of those on the left there from the principles of safe systems. So adapting the structure and function of the system to the complexity and needs of humans is a long way of saying that humans, as you see there, are physically vulnerable in our natural state. Inside and outside of vehicles, we're vulnerable. We're prone to error. We make mistakes. And we're impatient a lot of times. You see this among cyclists, walkers, as well as drivers. You see people, for various reasons, acting in ways that suggest they're impatient. This is Peter Firth's sort of his explanation for how humans tend to be when traveling about. There's also a lot of other research on basically what drives human behavior, and so a lot of this is across different behavior classes, you have the values that people hold. These often predict any behaviors in a number of different realms, including transportation and travel. And also their social environment. So to what extent that particularly people close to them in their social groups are acting in a certain way, that tends to predict individuals' behavior. So we need to set up systems that really understand humans and how they function, their limitations, and to minimize the likelihood and severity of those limitations and the mistakes that people are generally going to make. So we have great examples in graduated driver's licensing that when implemented well, really does have significant safety gains through lived experience of driving, the driving task, and for those novice drivers, limiting the number of people in their vehicle at any time. So if something terrible were to happen, you're minimizing also the fatality toll. But also thinking about intrinsic values that people have. I'm not sure how many have seen this wonderful PSA from Sussex in the UK, the Safer Roads initiative they have there. Definitely recommend watching if you have time to look at this YouTube video of this appeal to people to wear the seatbelt based not on fear or anything else like that, or about their personal care, but care about themselves as a parent and their family members. So what you see in this video, which is quite striking, they're really appealing to people's emotions for warmth and for familial bonds, where this person's driving this father and is apparently getting into some trouble, and the mother and daughter are watching, and they immediately spring to action and go and wrap themselves around, not unlike a seatbelt would the driver. Just showing that, you know, you're actually considering your family members when you're wearing a seatbelt. You're considering your safety and thus the sort of well-being of your family. So it's just a really great example, one of the best ones I think I've seen, of something that appeals to this intrinsic value for, you know, caring about your close others. Wes is going to talk a lot about this construct here. So part of safe systems is really orienting the field away from just crash reduction. Certainly crashes are bad, but a lot of them are pretty minor, and really focusing on the ones that are going to be, you know, have serious or fatal outcomes. And so when you talk about that, we're really talking about kinetic energy transfer. So how do we design systems that we manage and reduce that kinetic energy that's transferred among road users? Wes will talk a lot more about that. So I'll just go to the next one, which is more sort of cultural. I guess you could say this is part of traffic safety culture, is that more of us in this field really get to a point where we're treating road user safety as a foundation. This is not a trade-off. This is more of it's foundational. It really does require further discussion about what is safe enough, what are we really talking about when we talk about mobility and access. And then again, this idea of a traffic safety culture. How do we get more people incorporated into this and welcomed into this realm where we are really privileging road user safety? So how we like to think about it at CSCRS is that it really becomes foundational and it forms the bedrock of this basic safety principle for all of these other lofty goals we have. Mobility and access and mobility justice, etc. Comfort, participation in civic life, and thus eventually enhance well-being among the population. And here's an example of what that might look like with safe systems incorporated into more of a complete streets model. Complete streets has been it's been around for quite a while now. It's been around for about 15, 16 years. The way we see safe systems incorporated into this is that it forms the foundation on which you do achieve access, which then leads to activity participation in civic life, and then well-being. So related to this is getting everyone together to start working in a more coordinated fashion. So it's wonderful to see at the beginning that the poll results of the funding being shared. So we have different groups. This is inherently multi-sectoral with people working in transportation, injury prevention, trauma centers, even media, how they cover these things could be helpful or harmful to us. And vehicle manufacturers, all sort of working together, coordinating action. We're all working in these fields, but oftentimes it's quite siloed, as we know. So how do we make sure that we're coordinating our efforts? And then having this systems perspective, basically understanding our role in this broader system, how we can do this. So this is an example from Rod McClure. He provides an example of dealing with drug driving, how different groups are working in this realm, but often in quite different fields. So how do we start sharing information, sharing even staff and resources, sometimes funding, to start working together and to start anticipating consequences, unanticipated consequences in development. How do we respond, for instance, to staff disruptions and disruptions in funding? Really thinking through that from the beginning and working in this multi-sectoral fashion to really start realizing a future without fatal or serious injury. So with that, I'd like to hand it over to my colleague, Wes.
Perfect. Thank you so much. And again, we are going to stop right now for question and answer period. If anyone has questions, you can put those into the chat pod on the left-hand side. And I am also going to move us over to a poll question that we have for you all. So our first question is, which of the following is not one of the rural relevant traffic safety issues mentioned? Alcohol and drug impaired driving, pedestrian safety, congestion, access to emergency services, speeding, or I don't know, I don't remember. And the second one is, the core principles of safe systems are to adapt to human behavior, manage energy transfer, treat safety as foundation for all interventions, and foster shared vision and coordinated action. True or false, or I don't know, I don't remember. We'll just give everyone a few seconds to fill those out. And again, that chat pod's still on the left-hand side if anyone has questions thus far. Okay, and it does look like everyone's had a chance to fill out our poll. So I've gone ahead and broadcast the results if you'd like to address those for us.
That's wonderful to see. The first one, which of the following is not one of the rural relevant traffic safety issues mentioned? 88% are correct in saying that congestion was not mentioned. So that's wonderful to see that the vast majority of you totally got that one. Did not mention congestion. The core principles of safe systems are to adapt to human behavior, manage energy transfer, treat safety as a foundation for all interventions, and foster shared vision and coordinated action. That is true, and 98% of you got that, so well done.
Okay, perfect. I'm going to move us back over to our presentation. It doesn't look like we have any questions yet, so if any do come in, we will take them at the next question and answer period. As always, you can put those in at any time, and it doesn't have to be a question for any particular presenter. Any of them can answer during any of the question and answer periods. So our next speaker is going to be Wes.
Hi, yes, this is Wes Kumfer. Thank you once again for attending this webinar. I am an engineering research associate at the UNC Highway Safety Research Center and the the research program manager for the Collaborative Sciences Center for Road Safety. And I'm going to address our next two learning objectives, being differentiate safe system practices from other approaches to roadway management, and to illustrate specific safe systems processes or practices in rural contexts. So, usually when I'm talking about safe systems and giving an introduction to this concept to people, I get asked a lot of questions. These often are, what is safe systems? What does a safe system look like in a rural area? What have other countries implemented? What options do we have when funding is limited? And how do we control speed in a rural area? And I think that last question is very important. It's going to be something I'll touch on quite a bit. So as Seth illustrated, safe systems is a roadway safety management philosophy that approaches safe roadway as a system. It's a method of building in redundancy through the different components that interact on a transportation system. So if we look at things like roadways, vehicles, speeds, and road users, if we could just make all of those different components safe, then we would have settled the road safety problem. We'd have zero death and injury. That seems pretty intuitive. The problem is when you start to think about this, well, how do we make safer road users? How do we make safer vehicles? What can I, as an engineer, do to reduce speeds? Some of these questions become a bit more complicated, although there are things we can do. Maybe our posture isn't so much to think about how can we make safer road users, how can we get people away from that driver error that is so often cited, but instead, how can we work with road users and the system that we've built for them to make something that doesn't punish them if they do make a mistake? Because all of us make mistakes. We're fallible. We are prone to zoning out or to lose moments of attention, and we're not going to be 100% focused every single time we get behind the wheel. So the idea behind a safe system is simply to provide a system that doesn't punish you if you do happen to make that kind of mistake. So as Seth mentioned, we have 4 key principles of safe systems that we talk about a lot at CSCRS. And that would be adapting the structure and function of the transportation system to the complexities of human behavior, managing the kinetic energy transferred among road users, treating road user safety as the foundation of all system interventions, and fostering the creation of a shared vision and coordinated action. I'll probably touch on all of these, but the one I really am going to focus on today in my session is going to be managing the kinetic energy transferred among road users. This, I think, is the biggest issue because if we're talking about fatalities, if we're talking about zero death and injury, then kinetic energy is the big issue. That is the thing that kills people. It is what we have not necessarily done a good job of addressing in this country. So if we were to try to differentiate safe systems from what's been done before, and I also like to bring this up because a lot of you said that you already do practice safe systems, which is awesome. I'm hoping that that is based on a genuine difference and differentiation from more traditional methods, but we can also recognize that we're not throwing the traditional methods out with the bathwater. We are taking what is done and what's good and building redundancy, building resilience, building better practices into what already works. And so we already know that speed management works, and so we're trying to approach a safe system from one when we don't necessarily have to do these onerous speed management things because we already have a roadway that we've designed that is safe and that naturally reduces the speed. And so I'll talk about that a little bit as I go on. But one way that we might differentiate safe systems from other roadways is by emphasizing management of latent risk over high crash locations. I know a lot of places in the U.S. are already moving towards this, where they are shifting from just a hotspot treatment approach to a systemic safety approach. Considering kinetic energy, not design standards, the key consideration in roadway design, I would say with the Highway Safety Manual entering into its second phase and some of these other guides that are being revised and implemented, we are moving away from just nominal design standards that we go out and pick because we think it'll work, to actually saying, okay, what is the actual safety benefit of, say, this lane width, of rumble strips? And we're trying to do more evaluation with that. Aligning the functional classification with design and speed, this is a very important one and one that has been done very well overseas, and so I'll talk about that a bit. And then last, leveraging feedback loops and shared funding streams to create change. And I just want to go back to that poll question we asked at the beginning. I'm very encouraged that a lot of you are already doing this and already sharing funds. I think it's still a critical limitation in a lot of areas, and I'll bring that up again later. But we do hear from a lot of people, oh, I'd love to, say, put in a separated bike lane, except we don't have the funding to do that. I'd love to put sidewalks here, but we don't have the HSIP funds available. We can't afford our matching funds. We can't put up what we need to do to make it safer for non-motorized vehicles or non-motorized traffic. So I think this is still a barrier in a lot of places. But some other things that we might consider is if we look at a traditional approach, we could think of it as being characterized by very linear thinking. And this is, as any undergraduate engineer learns, you pick some design speed that corresponds to your functional classification for your roadway that you're trying to achieve, and that's probably out of the Green Book or one of the other guides, and then you set your speed limit 5-10 miles per hour below that. And it's sort of a fairly linear relationship, whereas if we are doing this in a safe systems approach, we want to get away from this linear thinking and get into a systemic thinking where we start to say, okay, well, we have this roadway that we want to use to provide access. What sort of modal share do we really want on this? If we are providing a lot of access, then we probably want a lot of modal share. And based on that modal share then, what sort of speed do we want to encourage that will keep everyone safe? If we have a lot of pedestrians and bicyclists, then we probably want pretty low speeds, maybe 20 miles per hour, 25, 30 miles per hour. If that's the case, then maybe we should approach our different roadway design features, such as our lane widths, our sidewalks, our median barriers, all of that, a little bit differently. So it's not quite a one-to-one relationship with speed setting. Instead, it's approaching these as all different factors that influence each other. So what does a safe system look like in a rural area? Well, we might consider a reduction in kinetic energy through a variety of speed management measures, and I'll talk a lot about those. We want to ensure there are redundancies in the system if a crash occurs. Seth mentioned that with the issues that a lot of areas are having now of hospitals closing and a lack of access to emergency health. Honestly, that's a huge important factor that we don't talk about nearly enough. And I don't even mention it that much in my presentation, but we do need to make sure if we have redundancy in system that if someone is in a serious crash that they can get transported to a Tier 1 trauma center pretty quickly. We want to ensure that severity can be reduced if a crash occurs, and we want to provide mobility options in the area to promote other modes. Now that last one I think is a bit interesting because this is something that I have heard from different rural areas that they would like to have, say, better bicycling, better walking infrastructure, but they don't have the funding to do it. And yet when we look internationally to countries that have implemented safe systems best, you'll often find that even in a place like the Netherlands, way out on the rural roads, they might have bike lanes. And obviously, we're not the Netherlands. We do have some systemic issues we do have some systemic issues that are different from those that people in the Netherlands face, but it is something to consider of maybe if you build a certain piece of infrastructure that can encourage that modal use rather than waiting for the demand to be there in the first place. So let me transition here with kind of a typical rural road that you might find in any state. So I pulled this one from here in North Carolina, but it looks like any of the hundreds of rural roads I've driven on across this country. What we might see here, if we were to inspect and say, what are some of the safety problems? Well, we might see there's an undeveloped shoulder. We might notice that there looks like there's an access point or a driveway pretty close to a change in the curvature. And we often do find pretty substantial changes in curvature, especially if you're up in a mountainous area like Colorado or Appalachia. And those can make things unsafe. And then we also see this is a pretty open design that can encourage speeding. I don't know how many people I've seen just cruising at, say, 80, 90, 100 miles per hour out in West Texas simply because there's not a lot of change in the landscape. It's fairly flat. There aren't a lot of barriers to kind of hem drivers in, not much change in curvature, and so people just speed. And it's a problem. It's something that if there's a fatal crash, if there's a crash can often be fatal when there's that much kinetic energy. So if we try to figure out what can we do to address these issues, well, there are some guidance from the different countries that have implemented safe systems internationally. So in Sweden, we see things like center guardrails and speed limit reductions, plus the 2+1 roads. That would be having a variable additional lane that pops up to provide coverage and buffer. And I know that some states actually do things like this, say with Super 2 highways, where they do provide passing lanes that allow for some extra coverage to be there. In the Netherlands, they have their self-explaining roads. These are roads where the functionality and the speed limit design, these blend really well together. They do have bicycle facilities in rural areas, and they also went from a policy standpoint, getting buy-in from non-government partners to help seed some of the funding to help create policies for design and to help get the public bought into their sustainable safety program. And then in New Zealand, we see a lot of different practices like flexible road safety barriers, side and median barriers, rumble strips, widening center lines, widening shoulders, and different speed management, which I'll get into in a bit. So just some examples of what these might look like. You could have flexible barriers. You could have wider shoulders that provide good room to recover or that additional lane. Those are obviously international pictures. These next couple of pictures I actually pulled from the U.S. though, because I do think there are some communities here, rural communities especially, that actually do manage speed well. So you can do things like striping in a lane to create a buffer and hem vehicles in to slow them down naturally. You can paint speed limits on the road, and you can install some of these centerline barriers to help deter those head-on collisions that can be so fatal because of the kinetic energy. So if we were to look back at our roadway, based on these measures, some different things we could try here. We could widen that shoulder. We could reduce speeds maybe with crossings or signs or enforcements in geometry. We could try to make sure that people are slowing down when they're going to be nearing access points. And then we could also add a center barrier to, again, provide a little bit of a buffer there. So one thing I have mentioned consistently throughout this webinar is that funding is often a major hurdle, and we've talked to RPOs that say, look, I only have a couple $100,000 to do things. I don't know what I can do in my area. I do want to encourage that there are options. Now, I will note that I am an engineer. I come from an engineering background and not a transportation funding background, so I don't have all the answers for you. But I do want you to let you know that there are some options out there, and some of the references I've provided, I do encourage you to check those because there may be some ideas and things that you can try to bring up at the policy level. So we've seen that several of these states are moving towards systemic safety. So in Caltrans, they've exchanged their locally available HSIP funds for highway account funds. And then Oregon DOT, they split their state funds, I think the HSIP funds, into a systemic pool and then again their hotspot pool like what most states have. And that systemic pool they actually use to address rural road issues like roadway departures. And so Oregon DOT is doing some very interesting things with that. We also have seen that if you are going to be investing in safe transportation infrastructure, what you need to take into account is that a lot of these low-cost treatments that often get touted are not quite as effective and maybe not the best use of available funding. I apologize, the figure that I have here is not showing up. It was there in the slides. Jamie, I'm not sure, maybe we can put that in and show them later. But there is a graph that shows, you know, if you have a fewer number of sites, say 500, where you're implementing higher cost countermeasures, then that actually can provide a greater net reduction in crashes compared to some other countermeasures. And then we also see there's some different advocacy groups that you can work with. So we know advocacy groups like People for Bikes are helping people work on getting some bicycle infrastructure. I'm not sure what their allotments are like, but it may work where they can help provide and help get people encouraged to bike. We know that Vision Zero programs are helping different communities figure out how to pool health and transportation funding sources together. And then the Road to Zero network does offer competitive grants. But really what I want to illustrate from all of this is that speed and these different safeties, these are systemic issues. And so like this Rod McClure graph that Seth showed earlier, if you start to look at what some of these different elements are, that should give you a clue into what some of the different options that you might have. Say, we see enforcement, we see alternative transportation, education. These are all different ways to address safety problems, and so maybe you start working with your educators. You work with your transit groups. You work with your police officers to build feedback loops to then improve safety in your community. And so all of this, I think, has been pointing to what do we do about speed? I've mentioned speed over and over again because it's the big issue. And I just like to illustrate with the World Health Organization did a critique of the U.S. and found that our speed laws are not good. They do not promote safe speeds. And especially in rural areas, it's very problematic. But we do have quite a few options that we can use. So I pulled these from Traffic Calming on Main Roads to Rural Communities. It's an FHWA report, and there are a lot of case studies from Iowa that actually show different things that they've tried. So things like visual markers that naturally cause people to slow down, giving feedback to drivers relating their speeds that they're driving at. And then in different communities, we've seen things like lane markings, transfer pavement markings, even setting the speed limit lower, doing slow pavement legends, building in automated enforcement, although that is a politically contentious issue, but there are ways to approach automated speed enforcement to try to get public buy-in. If you can focus on the net benefit instead of maybe on the cost, that might be one way to approach it. But there are a lot of different measures that you can use, and so I do have this link here to help if you are curious about some different speed management measures you can approach. But again, to draw on the international example in New Zealand, they like to point out that this is a systemic issue, so you can combine things like enforcement, education, speed limits, direct planning, community engagement. There are all manner of different streams and different approaches that you can take that will help improve speed in your local area to get that kinetic energy that's deadly down. So I end with usually a question of where do we go from here? And with that, I think Jamie is going to bring up a couple more poll questions.
I am. Thank you very much. So again, we do have the chat pod on the left-hand side where you guys can put any questions. I do see that we have a couple comments over there that we'll address shortly, but we also have a few poll questions for you all as well. Our first one is, a safe systems approach is different from other approaches to roadway management because it emphasizes engineering judgment, it relies upon traditional transportation funding streams, it depends on education, addressing transportation safety, it emphasizes reduction of kinetic energy, I don't know, I don't remember. And the second one is, in controlling for speed, i.e. kinetic energy, in a rural area, which of the following would be safe system solutions? Road design and redesign strategies, for example, gateway treatments, enforcement, including automated enforcement, feedback to drivers, changes in speed limits, solutions addressing environmental factors, solutions addressing behavioral factors, all of the above, none of the above, I don't know, or I don't remember. We'll give everyone just a few seconds to fill that out, and then we'll have our presenter address those. Okay, and it looks like everyone may be done, so I'm going to go ahead and broadcast these results for Wes.
Very good. So that first question, a safe systems approach is different from other approaches to roadway management because it looks like most of you picked, it emphasizes reduction of kinetic energy. That is the big emphasis that we see across all of these different countries that have different safe systems programs. That's not to say that things like engineering judgment aren't still valuable or that even using traditional transportation funding streams, we should be using those to the best of our ability. So those things are still part of safe systems, but really what we're emphasizing is how is it that we approach a transportation system from the perspective of keeping people alive and healthy and using the transportation system to their benefit and not to their disbenefit. And if we're going to do that, then we do need to address kinetic energy first and foremost. And then the second question, in controlling for speed, i.e. kinetic energy in a rural area, which of the following would be a safe system solution? And looks like almost all of you, actually 100% of you, well done, picked all of the above. So yes, those are all options in our toolbox. Very good. Jamie, there's a comment in the chat box I'd like to address if that's okay.
Yes, absolutely. That was next on the schedule.
Okay, so Phil mentioned the alignment of function, speed, and design is largely access management of driveways and intersections, and I want to say yes, that's definitely so. And it's not something I was able to spend a lot of time on with my presentation, but that's what they did in the Netherlands with their self-explaining roads, is you approach your relationship between access and mobility as very much dealing with where can drivers go, how often do they need to pull off the road, and if so, then we need to keep speeds low. Whereas if you are going to provide high mobility, then you need to keep access very, very limited. And I know that can often be a challenge in rural areas here in the U.S. if, say, you have a high-speed highway that suddenly goes straight into a town, and then there are a bunch of access points in the small town, and then you get back out onto a highway. That makes it really hard to control and keep that separation between mobility and access to where it's safe. But this is something where I would say let's try speed management and gateway treatments going into those communities to make sure that when those access points do pop up, then the mobility has been reduced and we've prioritized then access and safety.
We also had another comment in here as well, also from Phil, that I just want to read out, and that is that in Colorado, their rural congestion is a safety issue caused by large volumes into ski areas and summer tourist destinations, and heavy volumes overwhelm the rural design elements for short and seasonal periods. And that is absolutely something that we see a lot of times with rural areas. And then you also have the safety element as well of them being non-local people who are driving roads that they're unfamiliar with. So I don't know, Wes or Seth, if you have any feedback on that as well.
Seth, you want to take that one?
Sorry, I was on mute. Can you repeat that question, just the last part of it, Jamie?
Yes, absolutely. So the theme of the question was, well, it was more not a question, but more of a comment about how it is, they have some issues in Colorado with the tourist traffic, high congestion for short periods of time on roadways that were really designed to be rural. And in their case, it's for tourism and ski areas. As far as the safety center, we've seen that a lot too, that not only is it short periods of congestion that rural areas have to deal with for tourism, but also the safety aspect as well of most of those tourists are non-locals, so they're unfamiliar with the area, also causing or leading to some safety issues as well.
Yes, I mean that is a pretty widespread issue, especially in tourist areas. Peak seasons, we have that here in North Carolina, mostly along our coasts, but also to some extent in the mountainous regions as well. It's always a struggle, right? Do we then start talking about trade-offs? So I think there is this sort of, it's less of a, it's more of a philosophical argument, right, about what do we think is basic safety? What do we think any serious injury is acceptable even in peak times? How do we get to this place where everyone's basically safe? We may have some collisions, but they're not going to be severe, but also maintain some type of reasonable flow of traffic, sort of tourist traffic, it sounds like. How do we also, as a tourist destination, create a place through different cues in the environment, but also among businesses and residents, owners in the area to promote a culture of looking out for one another and being safe. So I think it is more of a sort of cultural, philosophical argument than really, that of course relates to design, and then also just how we speak about safety and principles like looking out for one another. I can't really think of any examples off the top of my head. I know this is a struggle right now, so you're certainly not alone in Colorado with this issue. And I think it would be great to focus on this because it seems like it is sort of a critical issue where a lot of different concerns are conflicting.
I'll offer an answer that may not be very satisfying, but one thing we may want to try to prioritize in this country would be better long-range public transportation options that can get those tourists to and from different communities. I know that as a civil engineer for, say, a city, you have no say in that matter, but I think if we want to encourage policymakers, advocates, to back some of these other modes that can help move a lot of people safer in a way that doesn't end up causing some of these conflicts, that may be one way to approach it, even if it is a bit out of our hands. Pie in the sky, what I'd love to see in this country would be very good, sustainable, long-range public transportation.
Perfect. Thank you both for answering those. Before I do move us along to our next presenter, I do want to point out as well, Wes, underneath the chat pod, between the chat pod and the handouts, there is a box that says everyone, and then the one right to the right of yours should say presenters. Someone has asked you a question if you can answer that one privately, but I wanted to let you know that that is there. And at this point in time, I am going to go ahead and move us on to our last set of presenters, Rob and Joe from Clackamas County.
Okay, good morning or afternoon, depending on where you are. This is Joe Marek and Rob Sadowsky with Clackamas County. We'll be going back and forth with our presentation. A couple of the points we wanted to cover today is talking about specific safe system processes in practice, or that we are going to be practicing in the rural context, as well as learning about micro-targeting and the challenges of data mining for government agencies. So just to orient everybody, Clackamas County is the southern county of the Portland, Oregon metropolitan area. We're a fairly large county. We own and operate 1,400 miles of road. We cover an area called the Willamette Valley, which is a very fertile farm area, and we go up into the Cascade Mountains. So we have a very rich mixture of roadways, actually including some of those recreational roadways that were talked about just a few minutes ago. We are fortunate to receive a grant from the National Safety Council through the Road to Zero program to look at a safe systems approach for some rural areas and rural communities within Clackamas County. And so we are just really starting this process, and this is a very much learning as we're going along in terms of what does it mean for a local agency to really implement or begin to implement a safe systems approach, and putting those pieces together that we can put together at this point in time. A little bit more background about Clackamas County. We have a population of about 415,000. The population is roughly split between the urban fringe area and rural area. And as I noted, the study area includes two rural communities, which includes the city of Molalla and the city of Canby, and about a 12-mile distance as the crow flies between those communities. So it covers about almost 40 miles of collector and arterial roadway. The population of this area is roughly about 50,000, and it represents roughly about 20% of the overall crashes within the county. And we've actually done some previous work with the city of Molalla and the surrounding community around some work involving developing a positive safety culture within that community. So the county has a transportation safety action plan. The first one we developed in 2012. We just did an update, which was adopted by our Board of County Commissioners in March, where we've adjusted our goal to reflect eliminating fatal and serious injury crashes by 2035, because when we talk to people, the answer is zero. Nobody in a family should die as a result of a vehicle crash or be seriously injured. And also within our safety action plan, we have that plan essentially adopted or reaffirmed by the county's Board of Health. And we did that as part of our efforts to make sure that safety and health are incorporated by way of policy within the county. And further, the goal of eliminating fatalities in the county is reflected in the Blueprint for a Healthy Clackamas County 2017 to 2020, which is essentially the county's community health improvement plan. So we've been working very hard to make sure that safety and health are incorporated across the organization, which ties in very well with this notion of a safe systems approach. So the National Safety Council grant, we're doing these two elements of a safe systems approach, which is systemic low-cost roadway infrastructure improvements combined with this social marketing, micro-targeting to particular populations of road users.
Our project just gets going on August 1st, so we're still, that's tomorrow, I guess. We're still working out a lot of our details, and we'll be excited to report on this when it ends. But again, it features two elements, a series of low-cost infrastructure improvements on the roads, which we'll talk about, as well as this social marketing and micro-targeting project. The project really incorporates a strong philosophy of public health, as Joe was talking about. This slide is going to demonstrate sort of normal, a regular person, a layperson might see a complete street in the picture below, but on the top right, this is what an engineer sees, a series of numbers and elements. But when we talk to our friends at the Public Health Department, this is how they see the street. And I don't know if you can read this, but essentially it talks about predeterminate health factors such as the environment that someone lives in, their age, their family structure, or their support systems, etc. And so one of the things that we need to do as part of a safe system is actually broaden that out beyond just engineering in terms of a safe system, but also looking at the system and the ecology that we all fit within. So we pulled together, you saw earlier the McClure graph that was shown. We put together our own explanation focused around social ecology. There is a download available that is my master's capstone project that covers the intersection between public health and transportation, particularly focused on Vision Zero communities, and goes more into detail of this. But imagine a person, Fred. He's a really great guy. He has a tough day, though, and in that tough day, he's having trouble at work. He ends up going to a bar, and at the bar, within a 1 hour period of time, he drinks 4 beers. He gets up to go out to leave, drops his keys on the floor. The bartender says, "Are you okay?" Fred says, "Sure, I'm fine." Gets into his car and leaves. As he's driving along that on the way home, he's having some trouble. There's a traffic light that's out. Things are starting to slow down. Finally, he gets a free space. He starts to drive, starts to escalate his speeding, ends out not being able to leave a roadway corner and crashes with a serious crash. And because it's out in a rural area, it took a while to get to that crash, and all those elements contributed to that serious becoming more and more serious. And we like to look at it this way because there's intervention opportunities along the way. From the Fred's boss, who may have done a better job noticing his stress level, to the bartender who, when he saw Fred order his 4th beer, should have said, "I need to pay attention here." When Fred dropped his keys, could have taken those keys away from him, and when he left, could have called for a sheriff to call to get that moment. To the people who are designing our roads and designing our road lights, maybe there's elements along the way. So that's the way we approach this safe system approach.
So we look at crash patterns in Clackamas County, our rural versus urban. Well, we have about 80% of the population in that urban or urban fringe area. We have about 55% of the crashes in urban versus 45% in the rural area, but only 20% of the people living in the rural area. And like was discussed earlier, we have a lot of recreational land, so we have people from the cities such as Portland traveling out into the county to recreate on the river or go up into the mountains, and so a lot of mix of users from many areas. When we look at our top crash cost factors across the county, we see our standard top 3 that kind of change places over the course of time but still remain consistent as our young drivers, ages 15 to 25, roadway departure or lane departure crashes, those vehicles that leave their intended lane of travel, and then aggressive driving, people speeding, following too close, etc., that we see a number of crashes from that. And then motorcycle fatalities have been a challenge for us, particularly in the rural area. And our alcohol, drug impairment also is a significant factor, along with our older drivers, and then our bike imped. And so that kind of rounds out those top crash cause factors that we see. And clearly, like many areas, we have those tragic stories that occur, the young, inexperienced driver who makes an error on the road, such as this person on the right, and is killed in a crash, or a driver error, such as this log truck that was unable to navigate a curve and goes off the road, or this one below where someone had had too much to drink and went off the road at a high rate of speed. Fortunately, that one was not a fatal, just a serious injury. But again, all those pieces that we want to both be able to look at potential upstream interventions as part of a safe systems approach, as well as are there different things we can have on that roadway system to create a little bit more protection and redundancy so those people can get home safely to their families. Moving forward to low-cost, proven infrastructure countermeasures, it was mentioned before about the program that Oregon Department of Transportation has with their All Roads Transportation Safety. We've certainly been a beneficiary of that program by way of funding, as well as the work that ODOT has done with putting together the various systemic countermeasures and calibrating those for the state of Oregon. So we have a very good suite of countermeasures that we're able to use and deploy, knowing that this countermeasure will reduce crashes by 15%, et cetera. So within this National Safety Council grant, this rural road network between these rural communities, as we begin to implement the grant, we'll do a network screening process of looking at all those roadways and looking at the types of crashes that are occurring along those roadways. And as an example, we can see roads that perhaps may have roadway departure as a significant issue on those roadways, or speeding, or we may have nighttime crashes that we see prevalent on one roadway. And so as we do that network screening process, it can guide us in terms of, okay, what countermeasures might we use? And in my simplistic way of looking at this, we have our countermeasure vending machine, where we can push the button and, oh, we're going to build some rumble strips. Oh, we're going to develop some high-friction surface treatments along these roadways, or add delineators. Some work we're actually currently starting to do right now is some 6-inch edge line as a pilot project. After a long conversation with our striping crew to make sure we could set that equipment up on the striper. So they're actually out striping in our beautiful sunny weather right now, working on that. And so again, with the work that ODOT's done with calibrating those measures, we can actually predict how we can reduce crashes on these roadways as we deploy those countermeasures.
Thank you, Joe. Now we're going to talk a little bit about the social marketing side, and I'll introduce you to what we're doing, and also what micro-targeting is, and the difference between social marketing and social media. And just the teaser, the title here, social marketing does not equal social media posts. So what is social media or networking? What is social marketing? So social media refers to websites and applications that are designed to allow people to share content quickly, efficiently, and in real time. So think of Twitter or Facebook as primary components of that. But social marketing is an intentional use, certainly of many of those channels as well as other channels, where the social good is always the primary focus. Here's an example from the National, or 3 examples from the National Safety Council on using social media to post information and provide education, but not necessarily changing behavior around social marketing. The key concepts behind social marketing includes that the ultimate objective is to influence action and to change behavior, that the benefits people receive must be greater than the costs that incur, so that if you're trying to slow speeding down, you have to showcase that it's better to be safe than it is to arrive 6 minutes faster, for example. And the programs will be more effective if based on an understanding of the target's audience's own perceptions. And in understanding the target audiences are seldom uniform. Recommending behaviors always have competition. There's always choices involved that people make. And that the marketplace itself is constantly changing. Now, that's a lot of stuff for folks who might normally be doing engineering work to start thinking about social media and social marketing. And even within our role, our work here, our public governance and affairs organization really is much more comfortable with social media than they are social marketing. So here's some real-life examples of social marketing. This is a campaign out of Quebec called Buckle Up. Kind of tugs at the heartstrings a little, but has a real clear call to action, and that call to action is buckling, but not with a strong sense of fear, not with a strong sense of sort of blood images, etc., although it does make a real clear consequence message within that. The World Wildlife Fund has a campaign where they actually were installing these paper towel features to sort of say every time you take an action like taking a paper towel, it has an impact on the rainforest in Brazil. Another factor of our work is that we incorporate the positive culture framework. This is a model developed by the Center for Health and Safety Culture out of Montana State University. And essentially what it does is combines that social ecology understanding that people live within culture, within a framework of a variety of environmental factors, such as their school or their education, their employment, etc. And within that, cultural norms get developed. And so, for example, one of our communities, Malala, there's definitely a cultural norm amongst teenagers to speed. There's a sense that you should also be able to hold your alcohol. And so those norms are things that we need to understand in order to approach this. And we need to look at benchmarks around those norms, start asking questions around those norms. But also the framework, positive cultural framework, is really seated in developing a positive culture, not around fear. Those are challenges because a lot of what we do is that sort of click it or ticket type of approach doesn't work within this positive cultural framework. And part of that is that we're bombarded by negative and more and more negative images and messages every day, and to cut through it, you have to do something different and something focused on positive, or you're just going to have to be even more negative than the previous ad. So here's one example of something that we do. We wrap vehicles as a freight vehicle, one of our fleet that goes around, makes deliveries, but it's free advertising for us essentially. And it's wrapped in a fun comic book style of a graphic with a clear call to action. This is where we're trying to showcase the need that people will have a tendency to want to text while they're driving, so select a designated texter before you get in your car. Let me talk a little bit about micro-targeting now. So micro-targeting is a marketing strategy that uses consumer data and demographics to create audience, subsets, and segments. And it's possible to predict the buying behavior and to influence behavior through hyper-targeted advertising. We see this very much in the political realm where people will look at, well, if you're more likely to shop at REI, you're more likely to be an environmentalist, and therefore you're more likely to listen to certain types of messages. Big data is really key to make this work. It's grabbing resourced information from a variety of trusted sources, some of them our own sources, and identifying the right people. For example, if we wanted to reach teenagers, we pretty much know that Facebook is not the most popular amongst teenagers. We need to be thinking of different channels and looking at who's on Snapchat and the filters that are available within Snapchat to potentially reach teenagers. Here's an example using Facebook ads to target. Essentially what we're looking at here are ways to sort of start fine-tuning some of those ads based on age, location, what year they graduated from high school, a variety of things that, when we started even looking at this, we had no idea some of the opportunities to look at some of this data. But maybe you ask, whoa, that's stuff we don't do in government, young man. Well, here's an example, Smart Trips Austin, where they're trying to encourage newcomers into the city and people who have moved to make different choices about how they get to work, maybe by walking more, or taking transit, or bicycling. And they're accessing information from new home buyers information that they have in their records, or new water and utility accounts that are opening up, or in partnerships with realtors. So some people, we already are doing some of that. I'm going to give you an example of some of the things that we're thinking about within the framework of this project, is that we know that motorcyclists have a higher incidence of serious and fatal crashes. But we don't want just all motorcycles. We want motorcyclists who live in that target zone that we mentioned, primarily age 45 to 65, because that's where we see some of the higher incidence of crashes. Maybe who have purchased a new motorcycle in the past year. Maybe who have not taken a class from Team Oregon. Maybe a certain size motorcycle, because we know that larger motorcycles are harder to handle. Those are the kind of opportunities that we're going to be looking at. We've never done this before, and we've already reached and found some pitfalls and challenges that I want to share. One is that some data is too private for government. It may not be too private for Pepsi-Cola, but do we really want to know what color motorcycle someone rides, or who they're normally communicating with, and a variety of things that's out there. Big data can cost a lot of money. We've already had some conversations with folks where we're not talking $5,000, we're talking hundreds of thousands of dollars to access some of this data. And that data requires big storage that we don't have. We don't have any protocols, policies, and expertise lined up. We need to be thinking about that. And what about sharing a disclosure about our activities and what we're doing? Does the public have access to some of the back-end information and what we're looking at? So here's our project. We're going to hire a consultant experienced in social marketing, not just social media, and use behavioral and cultural change education using that marketing target in order to effectively reach a targeted rural area. Those professionals will be utilized to build the internal capacity to conduct micro-targeting using social media ad buys, direct email campaigns, and in-person conversations. And the focus will be on common behaviors that cause the most serious and fatal crashes in the county. One of the things I'm really excited about this project is the consultant will also be responsible for training our team, including our public health team, our public governance affairs and communication staff, some of the folks working on areas such as tobacco cessation or prevention of suicides, because all of that is really going to, all that training will help us build our capacity to be able to do this in other areas as well. The project runs through July of 2020, at which point we're excited to come back and share some of our key learning lessons that that we will have as part of this project. And if folks are, our contact information will come up, but if you're in one of those communities that are starting to look at some of these things, I'd love to be able to network with you and find ways to communicate along the way of that project. So thank you. Throwing it back to Jamie.
Perfect. Thank you very much. We do have this one last question and answer period before we get wrapped up with the webinar. If you do have any final questions, if you want to put them over on the left-hand side. I do notice that there are a few comments over there about some of the slides and how to perhaps change those. I will make sure that we get those to our presenters so they have them after the fact. At this time, we do have one final poll for our audience. The first one is social media and social marketing are the same concept, true or false? And then micro-targeting is a marketing strategy, uses consumer data and demographics, is used to influence behavior through hyper-targeted advertising, is being used as a transportation safety countermeasure in Clackamas County, Oregon, all of the above, none of the above, or I don't know, I don't remember. And we'll give everyone just a few seconds to fill those out. While people are filling that one out, Joe, or Rob, I will read out this last question to you guys. Maybe you can address it while we're waiting. The question is, how do you think that regional transportation planning organizations can support municipalities in developing their safety action plans and meeting their Target Zero Vision Zero goals?
regional I can talk a little bit about how our regional training, our own MPO is looking at this. Our MPO does have a Vision Zero policy that they're working on. They're focusing on how to dedicate funds into safety particularly, as well as what training and encouragement opportunities they can feature to encourage some of their local municipalities to better understand the program. But one of the things that we're talking to them that's really exciting is that they actually have a lot of communication staff, and they do a regional panel that essentially provides opportunities for surveying residents in the MPO region. We're talking about them doing some survey work for us with that panel so that we can have some good benchmarks to measure where we are, such as everything from do you wear seatbelts to do you know what the Drive to Zero program is, to a variety of elements. Do you ever drink and drive? And having that benchmark data will be really important, and they're in a much better position to do it than we are.
So this is Joe. I'll add one other thing in terms of depending on your regional or metropolitan planning organization. In the case of the Portland organization, Metro, they also actually run the parks. They run things like the garbage franchises and a bunch of other areas that are rich in terms of potential for other modes of outreach. And so that's another area to really tap. And what we really try to do is just talk about safety a lot. Whenever we're going to meetings, we're talking about safety. We're talking about having a plan can help shift an organization. And safety is very politically neutral because everybody supports people getting home to their families every night. So we're constantly talking about those positive elements about how safety is really a good thing for everybody.
And just a quick, go ahead. I was just going to speak to the poll. It looks like people were pretty spot on. There's a few folks that are holding on to the thought that social media and social marketing are the same concept. I just really want to press that that it is very different, and if you are working with a team of communication experts in your government, sometimes it takes some education and an explanation because they're not used to this type of types of communication, and sometimes uncomfortable with the type of risks that you might need to take in order to tug on some heartstrings, for example. And then on the right side poll, the micro-targeting, pretty spot on. So more information will come later when we report back on this work.
Perfect. And then, Rob, could you mention real quick about the handout that we've put in the handout pod for people?
So I just recently graduated with a master's in public administration, and I had to do a master's project, which we call the capstone. And I looked at the intersection of public health and transportation, particularly focused on issues around collaboration, leadership, and some structural components. So if you're either new to Vision Zero or have been doing it for a while, there's some really, I think, some really great recommendations. Or if you want to learn about the history of both the interaction of public health or the history of Vision Zero, there's some great sightings and a bibliography in there as well.
Perfect, thank you. And then Dana, could you bring up the other graphic so that we can discuss that real quick? Perfect, thank you.
Jamie, do you want me to address this?
Yes, please, if you wouldn't mind. And again, we apologize for it not showing up last time.
Yeah, so what this graphic is showing, this is from that NCHRP report 893, which was adapted from Frank Gross's Reliability of Safety Management Methods, Systemic Safety Programs. The idea here being that if you target a smaller number of, say, high-yield sites where you're going to be reducing these very severe crashes, so this is very much aligned with safe systems because we're not trying to reduce total crashes necessarily, but just the fatal and severe ones, first and foremost, then you may be able to actually get a better cost or better benefit for your dollar than you would if you were to address, say, a much larger suite of just small severity or less severity sites. So the example here being if you have $10 million, which if we're talking with rural areas, that may not be the case, and you spend $750 per site and you have 13,333 sites, you might get 10% crash reduction. Whereas if you have the same amount and you spend instead $20,000 per site, but you only have 500 sites, you may actually get in total 27% crash reduction. And that's looking at severe fatal crashes, all these different things factor in. But really, if we have limited funding, what we want to try to do is make sure that we're getting a systemic risk reduction where the sites are worst, even if they don't have really good crash data to indicate necessarily that that's where fatal crashes have occurred. But if we know that this is a risk where fatal crashes can occur, and that's that systemic idea, then maybe we want to spend our money a little better. Thanks.
Perfect. Thank you again for going through that. That graphic is showing up, as mentioned before, in the PDF that you have downloaded in the proper space as well, but we did want to give our presenters a second to go ahead and explain that. We are going to wrap up at this point in time. We hope that you have learned in this webinar to describe the safety, health, and mobility needs of rural populations, to summarize core principles of safe systems, to differentiate safe system practices from other approaches to roadway management, to illustrate specific safe systems processes or practices in rural contexts, and to learn about the concept of micro-targeting and the inherent challenges in data mining for government agencies. We did want to provide you with some additional resources. I have listed the links for the Safe System Synthesis, Towards Zero Deaths, Vision Zero Cities, Road to Zero, and then on the next one we have the Clackamas County, Oregon Drive to Zero website, their Local Road Action Plan website, and then I do want to point out that the Safety Center's archived webinars, there are several webinars on both positive safety culture frameworks and as well as the Towards Zero Deaths and Vision Zero concepts. So you can take a look at those. There's over 40 different archived webinars on our website. I do want to mention our upcoming Safety Center webinar is August 22nd, and it will be on animal vehicle countermeasures. Again, you can also check out our archived webinars on our website. There are 2 other trainings I wanted to make sure you were aware of. FHWA is having a local road safety approach webinar on Tuesday, August 20th from 2 to 3:30 p.m. Eastern. The registration link is showing now on your screen and is also in that PDF handout. And then there is also a positive culture framework training that's being run by the Center for Health and Safety Culture at Montana State University. That will be happening September 24th through the 26th in Nashville, Tennessee. And then I did just want to leave you with the emails for our presenters in case you think of any additional questions that you would like to reach out to them for. And one last time, I'd like to thank Wes, Seth, Rob, and Joe for presenting today. I know I certainly learned a lot about safe systems and how it impacts rural areas. So thank you very much for taking the time today to present for us.
You're very welcome.
Yeah, thank you.
Everybody have a great afternoon.
Thanks, you too.